I'll never forget as a young attending, I was within my first 1 or 2 years of practice. I remember not getting sign out for the patients I needed to see in the hospital the next morning. I had waited all night to get them, and I'd sort of anxiously, I think I probably even got up a couple times in the middle of the night and emailed the person, hey, just checking on sign out. Because I always liked to see who I was going to need to see in the hospital before I got there, because it always made me nervous. Anyway, well, I didn't get sign out, and I remember getting to the hospital the next morning, literally in a ball of nerves. And I was sitting in the lobby of the hospital, still waiting to get sign out, and and I didn't know I was absolutely frantic, but apparently I was, because one of my colleagues came by and, hey, Jennifer, how are you? I was like, oh my gosh, I can't understand patients. And I remember him saying, are you anxious? I mean, what's going on? I was like, what do you mean? I'm not anxious. Blah, blah, blah. What do you mean? And I was completely anxious. I mean, I don't know that I was having a panic attack at that moment, but I was completely anxious and didn't even actually realize how anxious I was. And when my colleague brought it up to me out of concern, just saying, wait a minute, what's going on? What's wrong? And his observation of me being anxious was more of a question and like, hey, how can I help? I didn't even see that. I didn't see myself as being anxious. I didn't recognize it. And it's interesting because that encounter I didn't see that way until, I got into therapy, maybe, I don't know, a year or so later, and recounting sort of different situations. I did actually end up having panic attacks during my first 2 years of being an attending. And I associate it with being my first 2 years of being a young doctor because that's when it happened. I've always had low grade anxiety, or sometimes higher grade anxiety, let's be clear. It's always served me well. It's helped me do well on tests and perform well when I was, a musician and things like that. So it was an anxiety that, yeah, at times did go over the edge, but for the most part kept me functioning and at a high level. But as a young attending, my first couple years in practice was when it changed. And I found myself doing and being things in ways I didn't even recognize. I started having panic attacks. And that I actually did recognize because it was just the strangest thing. I remember at different times, I remember one time when I was in my office, I became very fearful of something with a patient. And all of a sudden, this heat wave ran over me, and I ran to my office and I locked the door behind me. I had a single office just by myself, locked the door behind me. I closed the drapes, or the blinds, and I literally took off my top and unbuttoned my pants, took off my sweater, took off my white coat, and I laid on the floor in a bra and pants half down because I was literally covered in sweat, drenched. And I remember lying on my floor and having to lie there for like 5 or 10 minutes before I could compose myself. And that sort of panic attack was something that I had on occasion throughout, that period of time. And I was able to recognize, okay, I think this is a panic attack. I started feeling that similar feeling that I got. I'm talking about this because, panic attacks and anxiety and things like that happen to so many people in so many different professions. And I don't necessarily link mine to being a doctor, but mine really sort of came of age, shall we say, when I was a young doctor. And there were a lot of stressful things going on at my work. I was a brand new attending. There were a lot of new things I was experiencing, a lot of work sort of situations that were difficult for me. And I'll just never forget that time. And it was confusing. It was tough for me because not only, as I described it, did I not recognize in the beginning that I was anxious to a point that was different than I'd ever been and that was outwardly visible. I started having these panic attacks where I literally have to go into my office or run into a bathroom, take off my white coat, unbutton my shirt, and I would literally be soaked. I started recognizing how anxious I was. My behavior was different. I recognize it sometimes. I remember starting to feel very, very insecure about my interactions with others. I started questioning how I seemed to others. I would leave an interaction, whether it was a happy hour or a meeting or something, and I would say, was what I said, was that okay? I wonder what they think of me. Did I say the right thing? I hope she didn't take offense when I said this. I questioned everything. I questioned every single thing I did. Every basic routine encounter that I used to have that was a no-brainer all of a sudden became almost like an existential crisis about how I seemed, how I was. And it was always based in me not being certain about myself and not feeling confident and always being worried about who I seemed to be and how I was coming across. I noticed I was drinking more alcohol than I ever had. Never been a big drinker, and I was drinking more alcohol than I ever had. And I recognized this because I recognized one night being drunk when I really didn't drink to get drunk or drink and end up drunk before. And I remember thinking that happened a couple of times, and I was like, things were just different. All of a sudden, life was different. Now, I have to tell you, all of these things I didn't put together at the time. I'm going through, and every day was a mini battle because in addition to sort of questioning my interactions with everyone, it also made me question my work. It made me question my skills as a doctor. It made me question my interactions with my colleagues. It made me question my interactions with my family members. I was not married. I'm not married now, but I was not married then, didn't have any roommates, but with my brother, my family, my sister-in-law. I mean, everything was literally up for grabs. And I didn't understand it. I always was worried. And I was always ruminating about something. I was always replaying in my mind what had happened, what I said, what I did, what I prescribed, anything, everything. I replayed almost like a movie. It was like a nonstop movie going on, where my life was almost not only filled with anxiety and worry, but it was also like this big movie of what had happened, of the past, just literally on constant rewind, replaying and replaying. And I perseverated on things. I perseverated on details. I perseverated on conversations. I perseverated on decisions. I agonized over them. I wondered if I'd made the right thing, if I should have done something different. Everything was hard. And the hardest thing about going through that period of time, and as I look back, was that I didn't recognize what it was until later. And it wasn't too late when I recognized it, but it was just later than I wish I would have, because maybe if I recognized it sooner, I might have gotten help sooner. I remember talking to a friend of mine from residency because I was so incensed about something. Again, it was during this time when anything would set me off and not make me angry, but make me worried, anxious, nervous, needing reassurance. I was talking to a girlfriend from residency because I wasn't afraid. I wasn't comfortable telling any of this stuff to anybody I knew, besides maybe my mom and my dad. But I was afraid to tell anyone how much reassurance I needed. I needed constant reassurance. I needed someone to listen to a scenario and tell me, did I do the right thing? Did I say the right thing? And so there were only a few people I talked to. One of them was a girlfriend from residency who I felt safe with. And I remember her saying, are you anxious? Have you thought about talking to somebody? And of course I got offended and said, what do you mean? I don't need to talk to anybody. Meanwhile, of course I need to talk to somebody. I called her because I needed to talk. And what she meant, of course, was therapy. And of course, that's what I needed. It was hard for me to admit and accept that I was anxious to the point of not being able to fix it myself. That was hard. Because I was a doctor. I'm a doctor still, but I was a doctor and I was there to fix and help other people. And the thought that I couldn't help myself out of this was unsettling. And it was shameful. I was embarrassed. I was embarrassed that not only was I anxious, but even more so that I was anxious to the point where I couldn't fix it. My attempts to regain control of my life every time I tried didn't work. My attempts to sort of reassure myself out of anxiety and to mantra myself into a better state didn't actually work. I couldn't fix it. And it was embarrassing. So I didn't tell anybody, but my girlfriend from residency, my parents, and my eventual therapist who I got. I went to a doctor at my office, not my office, but in the one of the departments to talk to them about medications for anxiety. I did get Lexapro, and I was like, okay, I'm going to try this. Well, it made me nauseous, which I counsel my patients that sometimes that can happen. By the way, this is not medical advice. I'm just saying. Made me nauseous, and I was very, very quick to sort of throw it out and be like, okay, see, I can't take it. Of course, I didn't stick with it. Of course, I didn't ask for guidance about it, right? Because I was reluctant to take it in the beginning, honestly. Like, did I want to take a medication? Nope. So that made me say, oh, can't do that. And honestly, I struggled for a lot longer than I needed to. I did get into therapy, which was very, very helpful. I had a therapist who was excellent. His name was Arnold, and he helped me see just so many things I wasn't willing, wasn't able, didn't have the capacity to see before. And it really, really let me know, number one, that I think everybody should be in therapy at some point, regardless of what you do for a job, whether you're a doctor or a lawyer or a, candlestick maker, whatever you do, I don't care. Everybody should be in therapy at some point. But he really helped me see things the way they were and not the way they felt. And I'll never forget him saying one thing to me that really made a difference. He said a lot of things. I mean, just a lot of things. But in terms of self-care, which was what I had not done a lot about, I beat myself up for being anxious. I beat myself up over not being perfect, not functioning well, not being as whatever as I thought I used to be. And I crucified myself in addition to being anxious and having panic attacks and all this other stuff. Oh, it was a mess, child. It was a mess. And I remember Arnold said, he said, show up for yourself. He said, show up for yourself the way you show up for your patients. Show up for yourself the way you show up for people you take care of. When someone comes to you with a problem, with an issue, you don't beat them up. You don't criticize them. You don't crucify them for what they're going through. You show up for them. And what he was telling me to do was to show up for myself. And it was really sort of the first time that I got permission to show up for myself in such a explicit, overt way, which I needed overt and explicit. I needed someone to bang me on the head and say, hey, why aren't you taking care of yourself? Why are you beating yourself up for being anxious? Why have you stigmatized yourself? Why have you shamed yourself? And it really helped me. I'm telling you this because these are some things that helped me. And also, I guess it was also important for me to talk about this too in the context of being a doctor, because as I've said, being anxious is not unique to any one particular person or career, what have you. But I think being a doctor made it harder for me to get help. I'm not blaming medicine for my anxiety. Well, no, actually I do. No. It is easy to be anxious as a doctor. But I don't blame medicine for keeping me away from getting help. That was my own issue. But being a doctor, I had just decided that I was supposed to be the one taking care of others and not the one needing to be taken care of, and not the one needing help, but the one there to help others. And that was wrong. And it is wrong. I'm saying this to everyone out there, and any of you who might be healthcare providers or doctors or even therapists to other people, psychiatrists or whatever you do, moms. You're there to be a mom to everyone else who is there to love and take care of you. Remember that you not only are worthy, but you have to show up for yourself. And you need to show up for yourself. And you need to be there for yourself. And it's okay and right and good, and it is necessary. Once I shifted that sort of paradigm and that dynamic in my head, it became much easier to reach out for help. I've been in and out of therapy for that situation was over 10 years ago, but I've been in and out of therapy since then, which has been a good thing. When I feel like I need a tweak or a tune-up or a reset, I go back into therapy and talk through things. I've been on medications. I resisted medications actually for another, year and a half, and I hate that I did that. That year and a half further beyond then, when I chucked the medications because it made me nauseous, I struggled. I suffered. And I struggled and suffered, I think, unnecessarily. It was my pride. And that's a shitty reason to not get help. I look back at the time, a lot of things got better, but I still struggled so much. It was literally like demons in my mind, just battling it out every single day. And I was resistant. I was insistent on, no, I got this. And I didn't. That's okay. I also have acne, or did, and I take medications for that. I also, have allergies. I mean, I don't shame myself for those things. People don't shame themselves because they get cancer or they have cholesterol issues or whatever. Don't shame yourself because you have anxiety or depression or bipolar or whatever it is you're going through. So I say this because I think medicine for me, I'm not blaming this on medicine, but it was a bit of it was complicated for me because I was a doctor and because of what I thought I was supposed to be being a doctor. I was unwilling to sort of give up that false paradigm I had created in my mind. I say this all to you all, that if this is you, if you're a resident or a med student or you're pre-med or whatever, and you are resisting getting help, and something's not right, you shut that shit down, you get help, and don't think twice about it. I should have started medicine long before I did. I'm on medication now. I have been since then, and thank God for that. Absolutely. And I never really talked about it before now. I think this is probably one of my first times ever saying that I'm on medication, but it was important for me to do this. Thank goodness I feel like the stigma around mental health is sort of softening. It's going away. I feel even more comfortable as a healthcare provider saying I'm on medication for anxiety. But Lord knows, if you know me, you know that I got anxiety. And that's okay. It's how I'm wired. It's what makes me me. What makes me fabulous me. But it's just something I've got to deal with, just like people have to deal with their asthma and their allergies and their this and their that. So especially for you healthcare providers, if you need help, get it. And if you needed someone to tell you that it's okay to get help, that's why I'm here. That's literally why I'm here right now. If you needed someone to tell you it was okay, I'm telling you, it's okay. And your life is about to get a lot better. So hang in there. I'm always with you. I mean that. Let me know what you think in the comments. I've never really done a video like this, so pardon me if I'm a little like, Let me know what you think. Let me know what your experiences are, your stories. Help other people. Healthcare providers in particular, but those who are not healthcare providers, no matter what you do. Because remember, this is a non-discriminating disease. So, anyway, let me know. Communicate with me. Let me know what you think. Now I'm getting nervous. I'm Dr. Jen Caudle. I'm a practicing family physician. I'm also an on-air health expert and video creator. I hope this was helpful for you. I'll talk to you soon. Oh, if you're not subscribed to my channel, I gotta say this. If you're not subscribed to my channel and click the little bell for updates, please do. I'll be back with more. All right.